Hello everyone, this is Dr. Humanist again. Let us now discuss about telomere biology disorders. Okay, these are a group of inherited conditions which are characterized by mutations which affect the telomeres. So what are telomeres? The repetitive DNA sequences at the end of the chromosome which protect them from damage and degradation. Right. What happens is each time the cell divides, so the telomere length shortens slightly. Okay, this is because inability of DNA polymerase to completely replicate the ends of the linear chromosome. Right. But there is one protective enzyme, telomerase. What it will do, it will add repetitive nucleotide sequences to the ends of the telomeres, which, which helps them to maintain their length and allowing the cell to continue dividing. But sometimes, or naturally also, when this telomere become critically short, okay, because of aging or other factors, these cells enter into senescence. That is a state of permanent cell cycle arrest, or they'll undergo apoptosis. Right. So any problem in the enzyme telomerase or any genes which affect the stability of the telomere will lead to certain disorders. Okay, which are characterized by like premature aging will be there, bone marrow failure, pulmonary fibrosis, and increased cancer risk. Okay, we'll see what are those disorders. So these are some genes which are associated with the telomere disease. So up till now there are 14 such genes which are discovered. Okay, some of them we'll discuss, that is TERT, right? It encodes the catalytic subunit of the telomerase. TERC is there, which encodes the RNA component of the telomerase. DKC1, that is discarin, which involves the telomerase assembly and stabilization. This RTEL1, it encodes the helicase. Helicase, what it does, it will involve in telomere elongation and stability. TINF2, okay, it encodes the component of sheltering complex, which protects the telomeres from being recognized as DNA damage. Right. So mutations in any of these genes will lead to certain disorders. We'll see what are those disorders. First one, dyskeratosis congenita, which was the first disorder which was identified in this category, that is telomere disorder. Okay. So classical presentation triad is there: abnormal skin pigmentation, nail dystrophy, and oral leukoplakia. This is the triad. Other than this, symptoms of bone marrow failure can be there: aplastic anemia, immune deficiency, those are high risk at infections, and pulmonary fibrosis, liver fibrosis, and certain cancers like leukemia, head and neck cancers and all. Okay. Next one is Hoyral Hridasson syndrome. That is nothing but severe form of dyskeratosis congenita. Okay, which is associated with extremely short telomeres. Okay, the patient will have symptoms in early childhood of cerebellar hypoplasia, immunodeficiency, severe bone marrow failure, and developmental delay. Next is Revesz syndrome. That is a rare variant of dyskeratosis congenita only, and it is characterized by R4R retinopathy, that is exudative retinopathy. Okay. In addition to that, patient might also have bone marrow failure, cerebral atrophy, skin and nail changes, etc. Next is pulmonary fibrosis or emphysema syndrome. Okay, which is mostly presented in the adults with mutations in TERT and TERC genes. Right. Next is aplastic anemia and Coats plus syndrome. Coats plus syndrome, which is characterized by retinal vascular abnormalities, that is Coats disease, and cerebrovascular malformation and osteopenia. Okay. Other than that, patient might also have bone marrow failure and gastrointestinal bleeding. So these are the overall clinical manifestation, like bone marrow failure will be there, aplastic anemia, lungs fibrosis, emphysema, liver cirrhosis, skin hyperpigmentation, nail dystrophy, leukoplegia, immune deficiency, so patient will have recurrent infection, neurological because of hypoplasia and atrophy, cerebellar and cerebral both, and developmental delay. Right, these are the overall symptoms which patient will have in this category of disorder. Now coming to the diagnosis. Okay, clinical evaluation, family history is very much important because there will be significant family history, and there is something called genetic anticipation. Means every generation, each generation, the symptoms will present early. Okay, this phenomena is present in this category of disorders. Okay. Other than that, physical examination will show abnormal pigmentation of the skin, nail changes, and oral leukoplakia. Next is genetic testing. Right, we have to see for genes which I just discussed: TERT, TERC, DKC1, RT1, etc. Okay, and telomere length testing. Okay, you can use techniques like flow fish, that is fluorescence in situ hybridization or quantitative PCR. What do we see there? Short telomeres in the peripheral blood cells, which is a hallmark of telomere disorders, right? Now coming to the management, okay, the main focus of the management is supportive care and preventing the complications, okay, because there is no definitive cure yet for these disorders. First one, stem cell transplant, right? As I said, there is a bone marrow failure, we can go with stem cell. Next is androgen therapy, like danazol. What it will do is it will improve the blood counts, okay, in the patients with bone marrow failure, okay, and the side effects of androgen is liver toxicity. Lung transplantation in the patients with severe pulmonary fibrosis, okay. Next is cancer surveillance. As I said, they are at high risk of cancers like head and neck cancers and leukemias and skin cancers, right? Next is immunosuppressive therapy can be tried, right, like anti-thymocyte globulin, cyclosporine, etc. Gene therapy is currently which is being trials are going on, okay. Gene therapy like uh, augmentation gene therapy, like introducing the functional TERT gene, okay. Other than that, telomerase activators, okay. So experimental therapies that activate the telomerase in somatic cells are still being explored, right? But the concern is because it can promote the cancer due to increased cell proliferation, right? As I said, telomerase will increase the telomere length and can lead to cancer. So this was the